Hypertension, commonly known as high blood pressure, is one of the most prevalent chronic health conditions in the United States, affecting nearly 1 in 3 adults, according to the Centers for Disease Control and Prevention. This silent yet pervasive condition contributes significantly to cardiovascular disease, stroke, kidney failure, and other major health complications, making it a critical public health concern. High blood pressure is defined as a systolic pressure of 130 millimeters of mercury or higher, or a diastolic pressure of 80 millimeters of mercury or higher. It is classified as primary, which develops gradually over years without a single identifiable cause, or secondary, which arises due to specific medical conditions such as kidney disease, hormonal disorders, or certain medications. Primary hypertension is by far the most common, and its development is influenced by lifestyle factors including high sodium intake, inadequate potassium consumption, obesity, physical inactivity, excessive alcohol use, tobacco consumption, chronic stress, and genetic predisposition. Research has shown that dietary patterns play a pivotal role in controlling blood pressure. The DASH diet, which emphasizes fruits, vegetables, whole grains, low-fat dairy products, and limits sodium intake, has proven effective in lowering systolic and diastolic blood pressure in both clinical trials and community-based interventions. Beyond diet, regular physical activity, weight management, stress reduction, and avoidance of tobacco and excessive alcohol intake are essential for prevention and management. Hypertension exerts profound effects on multiple organ systems. Chronically elevated blood pressure imposes mechanical stress on the arterial walls, leading to endothelial dysfunction and promoting atherosclerosis, which increases the risk of myocardial infarction, stroke, and heart failure. It can also damage the kidneys, leading to chronic kidney disease and affect vision through hypertensive retinopathy. Epidemiological studies in the United States demonstrate that untreated or poorly managed hypertension significantly raises mortality and morbidity rates, contributing to the nation's burden of chronic disease. The economic impact is equally substantial, with high healthcare costs due to hospitalizations, medications, and long-term management, alongside productivity losses and decreased quality of life. Management of hypertension in the United States involves a combination of lifestyle modification, pharmacologic therapy, patient education, and regular monitoring. Clinicians typically prescribe classes of medications, including ACE inhibitors, angiotensin receptor blockers, beta blockers, calcium channel blockers, and diuretics, tailored to each patient's clinical profile. Lifestyle interventions remain the cornerstone of both primary prevention and long-term management. Reducing sodium intake, consuming a nutrient-rich diet high in potassium, magnesium, and calcium, maintaining a healthy body weight, engaging in at least 150 minutes of moderate intensity exercise weekly, managing stress through mindfulness or cognitive behavioral techniques, limiting alcohol consumption, and abstaining from tobacco use are evidence-based strategies that significantly lower blood pressure and reduce cardiovascular risk. Early detection through regular blood pressure screening is critical, as hypertension often presents without symptoms, allowing timely intervention before end organ damage occurs. Community health initiatives, public awareness campaigns, and accessible healthcare services further support effective hypertension control at the population level. In conclusion, hypertension represents a major public health challenge in the United States, affecting millions of adults and contributing to serious cardiovascular, renal, and neurological complications. While the prevalence remains high, it is a largely preventable and manageable condition through comprehensive strategies including lifestyle modification, pharmacologic treatment, and continuous monitoring. Public education, policy-driven sodium reduction, promotion of physical activity, and accessible healthcare infrastructure are vital to reducing the burden of hypertension. Individuals can take active steps to lower their blood pressure and protect their health by adhering to a balanced diet, engaging in regular exercise, avoiding tobacco and excessive alcohol, managing stress, and following their healthcare providers' recommendations for medication and monitoring. Addressing hypertension requires a multi-level approach, combining personal responsibility with societal and medical interventions to mitigate risks and promote long-term cardiovascular health, ultimately ensuring a healthier population and a reduction in preventable morbidity and mortality.